Okay, no intro song this week. I am at work at the hospital, recording in an office, and so I don't have my usual equipment, my usual setup. So it might sound a little bit different. There may be ambient noise in the background because I am in a lab. I am signing out surgical cases today. For those of you who didn't know, I am not only a forensic pathologist, but I'm also a surgical pathologist. So that's the kind of pathologist that works in the hospital and diagnoses things in the microscope. However, I wanted to quickly kind of get to the point today. We're going to talk a little bit about Micah Miller's case, but this is not going to be an exhaustive review of the evidence that's been made available to the public. What it is it's going to be the POV of the medical examiner and kind of explaining why they made the call that they did on the preliminary, because I have been in a similar situation. So I think I understand a little more about why the call is made as it is. Now, this is called part one because I'm assuming they will release a final medical examiner's report, at which point that'll probably contain toxicology and things like that. And then we can discuss some of the final findings in the part two. Now, before we move on, I always like to correct mistakes from previous podcasts, and I had somebody email me and tell me that I misspoke about EDTA in the last podcast. EDTA is a chemical that's in some blood tubes, and what I did is I referred to it as an anti-chelation agent, but I think what I meant to say, because EDTA is a chelating agent, which means it is a chemical that binds like metals, like iron and things like that. So it is a chelating agent, not an anti-chelating agent. And I think probably when I was thinking blood tube, I was thinking anticoagulant, because a lot of those blood tubes have to contain a chemical to prevent the coagulation of blood, or else you can't run the specimen sample. And I'm totally fine if you guys email me or send me a message and tell me that I've misspoke on something, because I usually record these as a stream of consciousness with no notes. I just turn on my mic and go. And so as a result, there are sometimes mistakes. There are sometimes tangents that I go on. However, I kind of like that a little bit better than scripting, but that's just me. So there's a lot about this case that is, it's from a forensic perspective, at least what I know, is that it's not actually that difficult. But it's all this stuff aside from that, all the other ancillary information. And in that sense, that's what makes this a difficult case. Very often the autopsies are actually quite easy, and it's all the other information that comes out that kind of muddies the waters, so to speak. Because I have a lot of listeners who are not in the United States and may not be familiar with this case, I'm going to do a really brief overview of what happened. So this lady's name is Micah Miller, and she, I believe, lived in South Carolina. She was going through a divorce. She drove about an hour, I think, from her home where she lived into North Carolina, into a state park, and then she was found with a gunshot wound. Okay, so in addition to that, as this information develops, in the days after the case, we find out a little more about the husband, and he is a pastor, and there's some questionable reports about, possibly, I shouldn't say questionable because it is in fact documented, that there was, it sounds like abuse, at minimum psychological abuse. And I should also throw in that this is all alleged, because if I don't say that, then I open myself up to a lawsuit, and I don't really want to get sued. But the point is, it appears that this was not a great relationship. She had even, I think, filed a protective order against him, and then she ends up dead. So that alone would raise concern for a pathologist, for investigators, but there's a few things about this case that actually probably prevented that. So when we do postmortem examinations, whether they are external exams, partial autopsies, or full autopsies, we usually have a little bit of information that is available to us from police, from family, like talking to witnesses, certainly if there are any witnesses to a potential, to a death or a potential crime. And we get like a little coroner's report, which will contain information about medical history, social history, and things like that. This case, and I can't say, I don't work there, okay? This is in North Carolina, South Carolina. I work in Indiana. I don't know the people involved, but I am going to tell you based on what I know from my own state. If somebody is from another county and then dies in your county and you have to do the autopsy there, those reports are not as fleshed out, not as detailed, because we don't have access to those local departments. Like, to say it differently, if someone lives in your county and also dies in that county, it's very easy to subpoena medical records, to subpoena mental health records, to subpoena any legal records, to subpoena anything that can help you understand the case. And in this case, apparently it was not only a different county, but technically it was a different state, because she lived in South Carolina and died in North Carolina. So you've got not only, there's going to be a little breakdown between counties, but a breakdown because it's a different state as well. So in my experience here in Indiana, this would be like somebody being from Ohio and driving into my state and dying in Indiana. We're not going to have as much information because we just don't have, a strong connection legally with the police department. Now, let me say that all of that information is attainable without too much trouble, but it takes more time because we don't know their local police, their sheriffs, their prosecutors, their DAs, their everything, and plus just whatever state procedures, state laws, might inhibit that or at least slow it down. So when you have that happen, you're already at a disadvantage as the medical examiner, because you're really not going to have much information, as much information as you would if the person lived in your county and died in your county. Now, again, I am telling you, I don't know exactly what the medical examiners there had in terms of information, but it's probably not as much as what came out later, as a lot of social media true crime detectives and local reports, people, friends and family give their 2 cents and fill in a lot of the blanks. There's always more information later, which makes you perhaps think differently about a case. Now, before I get to a lot of the details of this case, and again, I'm not going to go over every single investigative ancillary detail because I'm a forensic pathologist, and so I want to describe why things were called the way they were, and then I want to kind of circle back and talk about some of those things that may actually make a difference, or at least are reasonable points. So I have worked all over my state, and I see cases, a fair amount where somebody is from another area and dies, and you're usually not given a ton of information. So you have to, at this point, you have to put yourself in the position of that office and what had happened at that point. And I remember, this is not a person who's a celebrity. This is just a woman they found in the park with a gunshot wound. So to them, this looks like a pretty standard case. And you might say, well, how strange isn't that a woman is found in a park with a gunshot wound? Of course, this is not a standard case. Well, when you work in my field, it is. I mean, it's not unusual at all for people to drive to remote areas and then pull the trigger. So by finding this body, it does not automatically, raise red flags. When you find a person who has apparently shot themselves in a state park. I mean, we see this quite a lot, and the reason why the public doesn't quite understand that is because the public doesn't see every suicide that happens. The suicides don't make the news by and large. It was one of the most surprising things when I went into this field to see just how much suicide there is out there that never even makes the news. In a 8-day span, about 2 weeks ago, I had 4 gunshot wound of the head suicides in 8 days. So 4 people, and not a single one of them was on the news. So from a medical examiner perspective, you find a body, it's got a gunshot wound, it's in the water, which again, it seems a little strange. Why is this body in the water? Why didn't the person just do it in the car? And you have to realize that suicide itself is not always what you think to be rational. Even though the person may seem somewhat rational before the death, comments that they make, things like that, it's not a rational act when it's being done a lot of the times. There are people, I have seen that before, where people go into water and they shoot themselves, or they do go into other strange places to do it. And not only with guns, but I mean hanging themselves and doing other sort of ways to kill themselves. So a body being in water is immediately, that is a red flag. But when you examine the wound and you examine the circumstances, then you start to kind of start to rule out homicide. And so let me speak specifically about what we know at the scene in this case. Number one, body is in water. Okay, that's a little bit of a red flag. But then gun found with body, gun found at scene, automatically that takes the red flag down back to normal, because how many people commit murder and then leave the gun at the scene? Now, before people get upset and say, oh, well, you can shoot somebody with their own gun, that is true, but we're talking odds here. We're talking, is it likely or is it unlikely? Well, it's actually quite unlikely for somebody to leave the murder weapon at the scene. However, we do have to still consider it. So then you count shell casings. Like, you look at the scene, you count the shell casings. Now, something was found. I don't know how many they found, but let's say it was 2 shell casings. And by the way, there was a report. I think the family did an interview and said that there were quote unquote multiple shell casings at the scene. We don't know what multiple means. It could mean 2, it could mean 3, it could mean 11. Certainly, if it's 11, then there should have been 11 shots heard. You know what I mean? So there were some, I think, people that heard a gunshot, or perhaps there was more than one gunshot. But what I'm getting at is, to find multiple shell casings at a scene which appears to be a suicide is actually not that unusual either. And people are surprised by this when they hear it. But here's why that happens. A lot of times, and we see this in my field a lot, someone who has decided to shoot themselves will sometimes test fire the weapon in order just to make sure it works, to get used to how much pressure they have to put on the trigger. It is not unusual at all to find multiple, namely, it's usually just 2 shell casings at a scene of a suicide. Because they do that test fire, or sometimes people call it like a courage shot. So they just want to shoot to feel what it feels like, and then that's one shell casing, and then they shoot themselves, and then that's the second shell casing. But for there to be more, you would also need to corroborate that with any witnesses who heard gunshots. But also, it wouldn't be horribly unusual, because sometimes people will fire a weapon multiple times just to get used to how it feels. So the multiple shell casings isn't as big of a revelation, although, I mean, it is certainly something that should be considered, because on the side of folks who think that it could be a homicide, if there is a struggle with a gun, then that gun could discharge more than once or more than once. So it's certainly something to consider. But when you've done forensic pathology and you have examined these cases, I mean, I don't know how many suicides I've done, but I'm guessing it's something like 400 or something, and most of which are with firearms. So, I mean, I have a lot of experience with this, and based on information that I've heard, it's not entirely out of the realm. Now, if you go on social media and you watch, TikTok or YouTube, there's a lot of people who've investigated 0 suicides who have concluded that it's murder based on the stuff that I just told you. But in the reality, in the scope of the forensic pathologist, it's not too unusual. So then what you do is you say, okay, body in water, red flag. Gun at scene, not red flag. Multiple shell casings, could be red flag, could not be red flag. So then you are now left with, what does the gunshot wound look like? And this is the key. This is actually where the forensic pathology really comes in. Because if the wound is indeterminate range, which means it's probably fired more than 3 feet away or so, then you actually do think that this could very well be a homicide. If the wound is medium range, some people call it intermediate, which is somewhere between around 6 and 30 inches away with a basic handgun, those are also very concerning for homicides. Because, just think about it. If you're 2 feet away, if you're going to shoot yourself, you usually don't put the gun 2 feet away from your body and then pull the trigger. So it would lean toward homicide. But if the gunshot wound is like a contact type gunshot wound, which means the barrel is in contact with the skin, then you feel much more comfortable that it's a suicide. Okay, so what we know is the medical examiner preliminary report said that it was consistent with a suicidal gunshot wound. And I'm not quoting it exactly because I don't have it here in front of me. And then they also made a statement that there was no gunshot wound to the back of the head, because when the story kind of popped up on TikTok, that's where I saw a lot of the information. Some TikTokers were saying there was a gunshot wound to the back of the head, and that just wasn't true. So I don't know where they got that. They just kind of made it up out of their own mind, or something like that. However, I will also add, and this is always surprising to people, that people do shoot themselves in the back of the head sometimes on suicides. It's not common, but it is certainly more common than a gunshot wound, let's say, to the neck, a gunshot wound to like the cheek of the face, a gunshot wound to the eye. All of those, a gunshot wound like in the nose region, all of those would be more consistent with homicide than a gunshot wound to the back of the head. Certainly a contact gunshot wound. But I'm digressing just a little bit. A gunshot wound to the back of the head would be more concerning for homicide, but it's not always. So the fact that the doctor said consistent with a suicidal gunshot wound, that tells me, as a person trained in this field, as a forensic pathologist, that the gun was either at the temple, so the side of the head, in the mouth, under the chin, or at the forehead. Okay, those are kind of the main 4 suicidal gunshot wound areas, and by and large, the most common are going to be the temple, the side of the head, and in the mouth. Those are the 2 that are the most common. And then some people go under the chin, and rarely somebody will put the gun to their forehead. So the fact that they said consistent with suicide means it has to be one of those 4, and it's most likely going to be temple or in the mouth. It's kind of gruesome to talk about, but when you've investigated a lot of these, you know the patterns. A gunshot wound to the cheek would actually be way more concerning for a homicide. But let's talk about the features of the wound. I will preface this by saying I don't know the features of the wound, but I feel like when you say consistent with suicide, that is forensic pathology speak for it was a contact gunshot wound. Not a close, not an intermediate, but a contact. And usually hard contact. So you're saying, okay, Dr. Wolfe, what are you talking about? Well, there are multiple kinds of contact gunshot wounds. There's close, we call it close contact, where it's just hovering above the skin. We call it loose contact when The muzzle is just barely in contact with the skin, angled contact where the gun is not pressed at a right angle, but it's actually at more of like an acute angle to the skin. So part of it will look like a contact and part of it will look more like a close gunshot wound. And then there's tight contact / hard contact, okay? And what that means is the gun is pressed hard into the skin. And so how can we tell? Well, we can tell that for a couple of reasons. If the gun is pressed hard into the skin, then you will have a lot of soot inside of the wound from the barrel of the gun, and you will have soot on the underlying temporal bone, the temporal muscle. And again, we're talking about if it's a gunshot wound to the temple. The reason why I'm using that example is because that is by far the most common that I see. You might even see soot on the dura mater inside the skull, and that's a tight contact when that happens. But also, there's another feature that's really important, and that's called a muzzle imprint. And basically, the muzzle of the gun makes an abrasion imprint around the wound, and it was a tight contact wound, because what happens is the gases from the muzzle of the gun go underneath the skin, and it causes a little balloon to form between the bone and the skin. It actually dissects the tissue away, and that all occurs in a fraction of a second. And that skin slams against the muzzle of the gun, producing a muzzle imprint, okay? Now, likewise, you can also see what's called radial tearing at the margins of the wound. So you have a defect where the bullet went through, and then because of that bubble forming in a thousandth of a second, it actually exceeds the elastic capacity of the skin, and it produces radial tears. So when you see radial tearing, you see soot in the wound, you see a muzzle imprint, it is without question 100% a hard contact gunshot wound. And so then, now I know your question is probably like, so what? I've watched TV and people put guns to people's heads all the time. Well, you got to remember, TV is different than reality. And I always tell people, if they want to understand why putting the gun to someone's head doesn't produce a lot of the features that I just described when they pull the trigger, use your hand, make a little gun with your hand, a little pointer finger, go up to somebody who isn't expecting it. Let's say it's your boyfriend, girlfriend, husband, it could even be brother, sister, whatever. And when they're not looking, I want you to take that finger and touch their head. And I want you to consider, do they move away when you touch their head, or do they press their head into your finger? 99 times out of 100, that person's going to flinch in a fraction of a second away from your finger. And that's enough space to prevent a hard contact gunshot wound. So even if someone's being executed with a gunshot wound, it's generally not a hard contact. And it's because they flinch when they feel that barrel go against their skin. To produce a hard contact in a homicidal manner, you would have to hold the head basically stable, press the gun against the head, and pull the trigger. And if a person is cognizant, if they are awake, or even if they're alive but unconscious, but I'm saying it's going to be difficult if they're awake, because you're going to have to hold the head, press the gun in hard. So then people will say things like, well, that could be done if you knocked them out with like a pistol whip or a baseball bat or something. Well, if that happens, then you're going to see trauma related to that. If someone gets pistol whipped or someone gets hit with a bat or something, it's going to produce a big laceration usually, and also a lot of hemorrhage in the underlying subcutaneous tissue. It's like a bruise basically. So in theory correct, but also in practice really improbable. Then also that's where toxicology can become important, but again, toxicology may not help either. Let's say you had a case where somebody had a bunch of drugs in their system, and then they also had a hard contact gunshot wound. Someone could opine that, okay, they were drugged, they were knocked out, then then the gun was pressed into their skin and the trigger pulled. True, you could do that, but also you have to remember sometimes when people decide to commit suicide, they will actually take a huge amount of drugs right before they do it, in kind of a way to prevent a couple different reasons. Number one is to prevent pain, and number two is to kind of decrease inhibition so that they will have they can kind of override their mind, especially if they really want to do it. We find suicides a lot where they have a 0.3 alcohol, or they have fentanyl in their system, or they have a bunch of Valium or something. So it's not unthinkable, even if there was a high level of drugs of some kind. In this particular case, it still wouldn't tell you that it's a homicide. Now, the other thing is angle of gunshot wound. That's going to be important. Was it going upward, front, back, or was it going straight across? Let's imagine a situation where somebody is unconscious and their head is on the ground, and then the gun is pressed into the skin and the trigger is pulled. Then you would expect to find a bullet in the ground underneath where that head was. And also you would maybe see mud on the side of the head. Now, in this case, the body was in the water, so that may have washed away. So maybe not so much. But if you can recover the bullets, it's very helpful. If you can recover the bullet from inside the body, it's even more helpful, because then you can match it to the gun itself with ballistics. And that's something that I'm assuming will be attempted to be done in this case, is to have the weapon test fired to see, was this the same weapon that was used? Because some of the other conspiracy theories is, yes, she brought a gun, but somebody else was there with a gun and shot her. But again, when you say that, then it has to be a hard contact gunshot wound, which is really difficult to do if somebody is awake and conscious, because you actually risk, if you are the person pulling the trigger, you highly risk shooting yourself, because you're going to have to basically get somebody in a headlock and then press the gun. So, again, I am speaking, you have to imagine we're on the day of the death where the body is found. We are on the day of the death. We don't have all this ancillary information. We have the body, we have the gun, we have a gunshot wound that looks like a suicidal gunshot wound. I would venture to say that 100 out of 100 pathologists, well, let's just make it 99 because there's always one goof, but let's say 100 out of 100, 99 out of 100 pathologists would have also called this a suicide and would not have thought one thing about it and moved on to the next case. I can tell you, as a person who has examined hundreds of gunshot wound suicides and homicides, there is nothing about the forensic element of this case and forensic pathology that makes me think it's anything other than a suicide. But now we start talking about ancillary stuff. So the death occurs. We don't know stuff about the husband, the restraining order, the possible abuse, alleged abuse, I should say. The family reports that he would not allow them to see the body unless they signed a cremation release. And of course, after cremation, you can't autopsy. So, I mean, that is a little bit suspicious. That is a little concerning. There's also some other stuff about, like, his lawyer is an expert in AI. At least that's what they're saying. And that some people allege that the 911 call was AI generated. And I also want to touch on that just real briefly, because I think the AI thing is really important. The pathologist and the medical examiner's office, I'm guessing they know there was a 911 call. And it was her voice on the 911 call saying, "I'm going to do this, please come and find my body." Let's, for a second, don't think AI. Let's imagine we're the pathologist, we're the medical examiner's office, we're the police there. If you get a 911 call and you say, okay, we found this body, body's in the water, weapons at the scene, there's a couple of, 2 or 3 maybe, and again, I'm speculating there, but a few shell casings, and the wound is definitely a hard contact gunshot wound, then you also have this 911 call. I mean, now that even that one goof that I said would say it's not a murder, now we're at 100 out of 100 pathologists that would call this case a suicide. I have absolutely 0% doubt based on all that information. But now let's talk about this AI situation. When I first heard people saying this, I thought to myself, this is, people are coping because they already had made a conclusion and now they're backtracking and they're trying to find any way to satisfy their own ego that they weren't incorrect. And we have to, I think people have to get to a point where they can take the L and say, yeah, I was wrong. However, as silly as it sounds, I actually don't think that it's a bad suggestion for people to make, regardless of what the attorney knows about AI, etc. Because we are living in a different world now. I can tell you that, I don't want to speak, so sure about it, but I'm guessing the forensic pathologist, any medical examining assistants, the police, etc., I'm guessing they didn't hear a 911 call and say, well, we better check that this is AI. And that's not because they're not good at what they do. It's because this is brand new technology. There are people out there who do not know that you can do this with a voice. In fact, there have been scams that have been run where people will copy the voice of a person and then they'll call like that person's parents or that person's brother or that person's son or daughter, and they'll say in their own voice, help, I'm captured, please send $5,000. And what it is it's an AI scam. But a lot of people don't even know that. And so, I even personally told my parents, and I said, hey, listen, if you ever get a phone call and it sounds like me, be aware that this could be a scam because they've got these voice changers now. I told them this about 3 or 4 months ago. Probably need to tell them again. And my other family members as well. So it is actually a real consideration. I think that the people who were coping hard, but I actually think that, it's not bad. I think it probably needs to be ruled out because we are living in this time now where people can fake videos, they can do deep fakes, they can do audio fakes, and at minimum, if you can just rule it out, then it helps you. If you can rule it out, you can say, okay, well, it was her voice on the 911 call. I personally don't think it would be AI, but that's just based on my experience, and I haven't had it come up. But is it impossible? You would say no, it's not impossible. But is it probable? So when you're signing out forensic cases, we sign out things, quote unquote, within a certain degree of medical certainty, end quote. And so, in other words, is it more likely than not? And so it's more likely than not that AI wasn't used, and it's more likely than not that some of this other stuff is, just a standard suicide. Okay, I'm speaking from the medical examiner's perspective. On the day that they did the case, if there was this treasure trove of information, of sort of suspicious kind of information available at the time of the case, maybe it would be held until the investigation is 100% complete. I would also bet that the detectives there have done more investigation than we know, because not all investigative details are released to the public in these cases. I actually think that these folks have released more than on a lot of these sort of true crime cases that come into the public eye. I think they've released a lot more, and frankly, in that way, I think that they've done a good job, but it hasn't actually diminished the amount of online true crime conspiracy. So no matter what positive information comes out for their case, there are 20 times the amount of people refuting that. And I'm not really defending either side here. I just know how it is because I'm on the medical examiner side, and we have people all the time denying our results, even though we have it all documented and photographed and everything. So there is another element here that I want to touch on, and that is I am aware that her family, I think they did an interview. I personally didn't see it, but I saw kind of outtakes and summary from some of the true crime folks on TikTok. And they said, quote, multiple shell casings, which I agree is, I think that's definitely worth, correlating. So in other words, is the number of shell casings found, does that correlate with the number of bullets that were missing from the ammunition box? So that's another thing we look at. There's a lot of little things we look at that we'd never even talk about. It's funny how many people actually don't know how crime investigations work, because right after the case started, I saw lots of videos, people screaming about, well, where's the gun? Where's the gun? We haven't seen the gun. And it's like, of course you haven't seen the gun. It's in evidence. Police take that gun and they put it in an evidence bag, and then they take it to the police station evidence room until it's time for it to be tested by ballistics. So the fact that not every single element of the investigation was released to the public, kind of causes these people to make it into conspiracy. And then when they say, oh, well, we've got the gun, then say, okay, well, let's move on to something else. We'll find something else that we can sort of pick on. But back on the interview, they also said there were bruises on the wrists. Now, here's the thing. It could be bruises, or it could not be bruises. The thing that is a little problematic here is that when a body is in water, sometimes the color of the skin changes, especially if it's in a warm environment, and areas can look like bruising that aren't actually bruising. And the only way to know if it's bruising is to take a scalpel and to cut into those areas. So why would wrist bruising be important here? Well, wrist bruising would be important if it's real, because if there's a struggle, people tend to grab people around their hands, around their wrists rather. And so bruising or scratch marks and things like that would actually be important. And whether or not those are actually bruises, we might never know, because if the wounds weren't incised to look for hemorrhage, then you're basically just looking at the surface. And I know that people are listening thinking, well, you just look at it and it's a bruise, just like if you were to look at your own mother and say, that's my mom. No, it's a little different with bodies that are dead. Things can look like bruises that aren't, and especially bodies that have been in water. There's something about, I think it's like almost like an early decomposition process where the skin color starts to darken in certain areas. But, again, I'm a little bit on a tangent here because I have not seen the photos. I will probably never see the photos, and therefore I can't comment. And even if I did see the photos, I don't know that I could be definitive on whether or not it's a bruise or a postmortem change from being in water on a warm day. Most of the bodies I get out of the water on hot days during the summer, they do have that. Sometimes they have an odd color change. But, again, there's a lot that we can't be certain about on this case. So that is, let's see if there's anything else that I'm not thinking of. It's being alleged that by the true crime folks that this is definitely a suspicious case, and I'm not going to say it's not a problematic case just because of all the ancillary stuff that's kind of come out on not her side but the husband's side. That sort of definitely doesn't paint him in a good light. But here's what I always tell people, that a person who is not a great person, not an ethical person, maybe you could just say really bad person, that doesn't equate to murder. It certainly puts it in that realm of, okay, maybe this is a person who's capable of this, but to actually make the diagnosis of homicide on a forensic pathology report, you have to have a lot of evidence to confirm that. So in this case, if the gun wasn't at the scene, that would be great evidence for that. If the gunshot wound was a medium range or distant gunshot wound, that would be good evidence for that. If even if she had a gun and the gunshot wound didn't look right, you would look at ballistics and say, did this come from her gun or from a gun that we can't find? So all of that is going to help you with kind of pushing it, whether it goes toward homicide or suicide. A lot of people have also said, well, why would she, I think there were people showing inside pictures of the car or something like that, and they were saying, well, why would she have made a sandwich if she was going to go kill herself? And other people said, well, how did she pay for a gun if she supposedly didn't have any money? And other people have said she sounds calm on the phone and they're on the 911 call, and therefore she couldn't have killed herself. And again, I have to stress, from a forensic pathologist perspective, none of that is unusual. People often are going about their daily routines and then they decide, okay, now's the moment. So whether or not there's a sandwich in the car, I mean, she may have made that. Maybe that was her favorite sandwich and she said, I'm going to eat a nice meal before I do it. But then when she got there, understandably, no appetite, I'm leaving it here. We find people doing things. I mean, I have seen people, one case in particular, a guy had made a grocery list and he was getting ready to go to the grocery store, and then he decided to kill himself. And so, like, why would you make a grocery list if you're going to kill yourself? It's because they're not necessarily planning every second of it to the T. I'm going to kill myself at 6 p.m. I mean, they're kind of in their usual mindset, and I'm going to go about my day, and then all of a sudden it hits them that, okay, now I'm going to do this. So when we see evidence like that, it doesn't really upset the forensic pathologist or the police investigators. People who, quote unquote, seem happy, like maybe they put messages on Facebook, they text people, they that sort of thing. That is actually more of a sign that they are going to do it than not do it. Because when people have made a decision that this is how it's over, I'm done, a lot of times they feel like a weight off their shoulders and they actually act quite happy. I'm not saying that's everybody, but I went through a very difficult psychiatry rotation when I was in medical school, and we saw that a lot. People who had kind of like almost like a moment of clarity and like, oh, okay, I'm happy now. It's all going to be over soon, and they actually get happy. So being calm, seeming happy, having daily routine stuff, although unusual to the general public who don't investigate these cases, to police and to forensic pathologists, it pretty much fits. And it fits pretty well. So, I do think that that's the problem, is that a lot of people just don't understand. The trouble with a case like this is that it's a highly emotional case. It's a sad case because it seems like she was a very unhappy person in her relationship. She wasn't treated appropriately, at least allegedly, by documents that were, I think, in the court. And so people have emotional attachment to this, particularly women who have been in a situation like this. I made a couple videos on TikTok where I kind of was talking about the forensic elements, just like I have here in this podcast. And that from a forensic perspective, at least based on what we know, it's a suicide. And I had people, attacking me and saying that I, basically support, spousal abuse, or I support abuse of women, or, this is why women choose the bear over being alone with a man, stuff like that. And when I see responses like that, I understand that it's highly emotional, because all I'm discussing is the forensic evidence from a pathology perspective. And I'm telling you, 99 or 100 out of 100 would, based on the information they had, would have called this a suicide. Now, maybe something will come up, in terms of additional investigation, that stuff that we don't know, checking out the 911 call, checking out the whereabouts of people who could be involved, that sort of thing. And it gets flipped. The case gets flipped. I mean, stranger things have happened in cases. However, this stuff develops over time. The death occurs on day one, the autopsy sometimes occurs on the same day or the next day, and then weeks after, lots more information comes out. And then that changes the perspective. And that's why the report that's released is often a preliminary report. And then the final report contains all of that new information that is sought and that is gathered in between the time of the autopsy and the final report. So I hope you understand where I'm coming from here. I'm not defending either side or any of that. I'm just telling you from a person who is board certified in forensic pathology, who has done over 3,000 autopsies, at least 300 or 400 of those being suicides, and I've looked at thousands of gunshot wounds. That's where the forensics is on this case. And that's why this is a part one. Part two may have something different. There may be ballistic information. There may be other stuff that comes up, and then it ends up getting called something else. But I do hope that I can get that final report when it comes out, and we can go over it, and I can put it into context of what we've spoken about today, and also what we've spoken about, or what has been spoken about, released by the departments involved. So I hope that this was a little bit helpful to understand where a forensic pathologist, or how a forensic pathologist examines a case like this, and why it got called what it got called. I'll just state again, I don't know anybody involved. Like I occasionally drive through North Carolina, but it's always the very far western part. I don't know anybody in that area. So I'm speaking on just as much information that you guys have. And just sort of like trying to help people understand a little bit. But we'll see how it goes. And I know this has been a long podcast. It could have been a lot longer, actually, because there's a lot of nuances to these things that needs to be discussed. But hopefully you listened. Hopefully you enjoy it and learned something. I also need to give a plug to my social media. If you're interested, Substack, Dr. Darren Wolfe. I teach on there. We do surgical pathology. We do forensic pathology. I give my opinions on stuff. There's a free side and a pay side. And I keep telling people that the pay side is I think it's a pretty good price, really, to get a bunch of free education. Not free. Of course it's not free. To get a bunch of education that otherwise you would have to go to medical school and residency to get. So it's a pretty cheap discount. The free side, I still put a lot of stuff on there. So that's Dr. Darren Wolfe at Substack. And then, of course, my Instagram is called The Dead Letter. My TikTok is called The Dead Letter. But I think you can type in Darren Wolfe and it should come up. I am also on Facebook, but my page there hasn't got much traction. It's attached to my Instagram page, The Dead Letter. But yeah, so YouTube, Knife After Death. And I think that's the bulk of it. So we will be back. There may be a podcast in the interim, but if the final report gets released soon, then I will go ahead and make a part two. And it may sound an awful lot like my part one, but basically we're going to get more confirmation on what everything really looked like the really nitty-gritty details, if the report is released publicly. So please, if I misspoke on anything, go ahead and message me and let me know. Thank you.